The White House and some governors continue to butt heads over the lack of and the need for personal protective equipment, PPE. On the ground in real life, frontline healthcare workers say they're risking their lives.
Yeah, I'm a little bit scared to speak. All the nurses getting fired because you spoke too much. If we want to do the right thing, like to protect myself and protect others, I think we do need more in general. We need more gear so we can do what we were told to do.
Sachiko Kiyomi is a registered nurse who works in a nursing home in New York City. Protocol says N95 masks are supposed to be disposed of after each patient, but she's worn hers for an entire day to stretch the hospital supplies.
So we are working with the fear.
Would you work still if there is no PPE gear?
Oh, yes. I will wear whatever napkin, whatever I can do.
Without proper medical supplies, some healthcare workers have resorted to bandanas and trash bags. This doctor was handed a plastic rain poncho instead of a medical gown. Online healthcare workers are using the hashtag #GetUsPPE to demand more supplies.
Any administration that is misbehaving during this time, you, the frontline clinicians, hold them accountable. If we all speak out at once, they cannot fire us all. You know why? They desperately need us.
It's not just healthcare workers, but hospitals, desperate for supplies, are asking for donations. They say they need sanitizers, surgical masks, goggles. Chicago surgeon Dr. Lauren Stryker has been pushing for cloth masks, not as a replacement for N95s, but to help prolong their use.
So that if you have that healthcare worker who only has one N95 and they have to make it last as long as possible, they can actually put this mask extender over their N95.
As frontline healthcare workers continue to speak out about the lack of PPE gear, some hospitals are threatening to fire them.
Any healthcare worker that's speaking out should speak out louder and scream and yell, and anyone who penalizes them, quite frankly, should be penalized. These healthcare workers are not only fighting for their lives, they're fighting for the lives of the patients they're taking care of.
Kat Sandoval, Newsy, Chicago.